In the next 10 minutes, someone watching this video may experience a heart attack. Not tomorrow, not next week. It could happen today. The surprising part is that many people experiencing a heart attack are not running, screaming, or collapsing dramatically. They may be sitting quietly, drinking tea, watching TV, or scrolling on their phone. And while everything may look normal on the outside, serious changes can be happening inside the heart. What you're about to see is a step-by-step look at what happens inside the human body during a heart attack, a medical emergency that can develop rapidly and change a person's life in a very short time. Stay until the end, because once you understand what really happens inside the heart, you may never look at chest pain the same way again. Before you leave, I want to tell you something important. This channel is not for everyone. It's for people who want to understand what is really happening inside their bodies. People who don't want confusing medical jargon. People who want life-saving knowledge explained in a way they can actually remember. If that's you, then this channel was made for you. Over the next few weeks, I'm going to take you deep inside the human body and explore things most people never fully understand. What actually happens during a stroke? The silent effects of high blood pressure. What cancer can do inside the body. The truth about diabetes and organ damage. What happens inside your brain during dementia. The biological secrets behind aging and longevity. Every video will be a journey inside the human body, showing you what most people never get to see. So don't miss the next one. Subscribe right now, turn on the notification bell, and become part of a community that believes knowledge can save lives. Because one day, something you learn here might help you protect yourself or someone you love. Right now, somewhere in the world, a person is sitting in a chair, perfectly calm, maybe drinking a cup of tea, maybe watching television, maybe laughing at something their child just said. And inside their chest, something catastrophic is silently beginning. They do not know it yet. Their face shows nothing. Their hands are still. But deep inside a network of blood vessels thinner than a drinking straw, a war has already started, and they have no idea they are losing. That person could be your father, your mother, your best friend. It could be you. This is not a story about statistics. This is not a lecture about cholesterol. This is a second-by-second, cell-by-cell journey inside the human body during one of the most violent and misunderstood biological events a living person can survive. And by the time this video is over, you will understand the human heart in a way that most people, including people who have already had a heart attack, never fully grasp. Stay with me. This might be the most important thing you watch today. Before we go inside the body, you need to understand something about your heart that nobody tells you clearly enough. Your heart beats around 100,000 times every single day, pushing approximately 1.5 gallons of oxygenated, nutrient-rich blood through your body every single minute. Every beat, every push, every surge of blood through your arteries is not just mechanical. It is a miracle of biological precision that most of us completely take for granted. The heart asks for nothing in return except one thing: a steady, uninterrupted supply of its own blood, delivered through a pair of vessels called the coronary arteries, which wrap around the surface of your heart like a crown. Live science. The moment those arteries are blocked, the countdown begins. And here is what makes a heart attack so brutally deceptive. It almost never starts the day it kills you. The real story starts years earlier, sometimes decades earlier, in a process so slow and so silent that your body barely flinches. Over years to decades, the primary coronary arteries that supply oxygen and nutrients to the heart muscle begin to narrow, largely due to atherosclerosis, a buildup of fatty plaques inside the arterial walls. You are probably eating breakfast. You are probably sleeping. You are probably completely unaware that the walls of your coronary arteries are quietly collecting deposits of fat, cholesterol, and inflammatory cells, building layer by layer, year by year, like rust slowly creeping through a pipe. Live science. When you have too much fat and cholesterol in your bloodstream, a harmful substance called plaque builds up inside the blood vessel walls, narrowing them and reducing the blood flow that delivers oxygen to all parts of your body, including the heart. At this point, your body is not alarmed. The arteries are narrowed but not blocked. The heart is still getting enough blood most of the time. You might feel a little chest tightness during hard exercise, something you write off as being out of shape. You might feel nothing at all. Millions of people walk around with severely narrowed coronary arteries and genuinely have no idea. Health Central. Atherosclerotic plaques are hard on the outside and soft on the inside, causing the arteries to become rigid. Think about that image. A hard exterior shell containing a soft, fatty, unstable core. For years, that plaque sits there, narrowing your artery, slowly, quietly. And then, triggered by stress, by a sudden spike in blood pressure, by inflammation, by something as simple as the physical exertion of shoveling snow or waking up in the morning, that hard outer shell of the plaque cracks. Live science. This is the moment everything changes. This is second zero. The crack in the plaque exposes the soft, fatty material inside to your bloodstream. When the plaque on the walls of the coronary artery ruptures, the fatty material inside becomes exposed. This triggers the blood platelets, which rush over to the ruptured plaque to stop the fatty contents from leaking out, thereby creating a blood clot. Your body is doing exactly what it is supposed to do. Your blood platelets are first responders. They sense a wound in the wall of your artery. They pile on top of each other. They try to seal the damage. This is the same process that happens when you cut your finger. Your body does not know the difference between a paper cut on your skin and a crack in a coronary artery. It responds the same way. Houston Cardiovascular Institute. The problem is catastrophic. A clot that forms at the site of the plaque only makes the blockage worse, either partially or completely arresting blood flow. What your body intended as a rescue mission becomes the murder weapon. The clot builds on top of the already narrowed artery. It grows, it thickens, and within seconds to minutes, it closes off the artery entirely. Blood cannot pass, oxygen cannot reach the heart muscle downstream from that blockage. And now, a section of your heart, a living, beating, working section of one of the most vital organs in your body, begins to die. Health Central. When a heart loses oxygen, it can't pump enough blood to power the rest of the body. This can throw off the heart's normal rhythm, and the heart can sometimes stop beating completely. Ask a biologist. Let's go even deeper. Because what happens at the cellular level in the first few minutes of a heart attack is something most people never fully picture, and it is absolutely critical to understanding why time is everything. Your heart muscle cells, cardiomyocytes, are among the most oxygen-hungry cells in your entire body. They cannot store oxygen. They cannot switch to an alternative fuel source the way some other cells can. They need a constant, uninterrupted delivery of oxygen-rich blood, or they begin to fail within minutes. In the first 30 seconds after blood flow stops, the affected heart cells begin to run out of the chemical fuel, called ATP, that powers every single contraction. The cells start losing their ability to maintain the electrical signals that coordinate the heartbeat. Calcium floods in. Membranes become unstable. And within 2 to 4 minutes of total oxygen deprivation, the process of irreversible cell death begins. Let that number sink in. 2 to 4 minutes. That is how quickly the heart's muscle cells begin dying from the moment blood flow stops. While your brain is still registering that something feels wrong, while you are still trying to decide if the tightness in your chest is anxiety or indigestion, your heart cells are already past the point of no return. No matter what type of heart attack you have, damage to heart tissue occurs fairly quickly. When your heart doesn't get the oxygen it needs to survive, it starts to die. The result is permanent scarring that can weaken your heart and prevent it from working as well as it did before your heart attack happened. Health Central. Now here is where the body does something remarkable. something that shows you just how desperately it wants to survive. When the nervous system starts communicating signals to the spinal cord, you start to notice aches in other areas of your body. The signals travel upward through your nervous system, and your brain, which has never directly experienced cardiac pain before, struggles to interpret where the distress is coming from. The result is something called referred pain. The ache spreads. It moves down your left arm. It rises up into your jaw. It settles into your back and your shoulder. Some people feel it as a crushing, unbearable pressure in the chest, like something impossibly heavy is sitting on their sternum. Others feel it as a dull, persistent burning. Some people, especially women, experience it as nausea, breathlessness, and a vague, terrifying sense that something is deeply wrong, without any chest pain at all. Houston Cardiovascular Institute. Your brain is being flooded with stress hormones now. Adrenaline surges into your bloodstream, instructing your heart to beat faster, harder, trying to compensate for the section that is failing. Your blood pressure spikes. You break into a cold sweat. Your skin goes pale as blood is redirected away from your extremities and toward your core. You feel dizzy. Your vision may blur. You feel anxious and lightheaded. Your body is fighting, desperately, frantically fighting. But here is the cruel irony. The adrenaline that your body releases to try to save you is also increasing the demand on the very heart that is already struggling. A faster heartbeat means more oxygen demand. More oxygen demand means the dying cells run out of fuel even faster. Your body's survival reflex is simultaneously trying to save you and making the damage worse. Every second that passes without treatment, more cells die. Without blood, the heart muscle begins to function poorly or stops working permanently. That is why every second counts regarding heart attack treatment, and why it is important to seek immediate medical attention if you are having symptoms, especially if they persist for more than 15 minutes. To receive the best care, you have approximately 90 minutes from the onset of the heart attack for a cardiologist to restore blood flow to the heart before critical heart tissue forms a permanent scar or is severely damaged. Say, 90 minutes. That window is not a guideline. It is the biological deadline between a manageable heart attack and a life-altering one. Let's talk about what is happening to the rest of your body while your heart is fighting for its section of tissue. Blood first travels from the heart to the lungs, where it is reoxygenated before returning to the heart to be pumped out to arteries that supply oxygen and nutrients to the brain, digestive tract, and the rest of the body's tissues. When your heart's pumping ability is compromised, every organ in your body starts receiving less blood, less oxygen. Your kidneys slow their filtration. Your digestive system goes quiet. Your brain begins to suffer. The shortness of breath you feel during a heart attack is not just panic. It is your lungs working harder to compensate for the reduced circulation and fluid beginning to back up into pulmonary tissue because your heart is not pumping efficiently enough to keep up with normal blood return from the lungs. Live science. In the United States, someone has a heart attack every 40 seconds. Read that again. Every 40 seconds, somewhere in America alone, a human being enters the experience you are reading about right now. And statistically, a significant percentage of them do not call for help quickly enough because they do not believe it is really happening to them, because they do not want to be embarrassed, because they mistake the symptoms for something else. Ask a biologist. The number one cause of death during a heart attack is not the blockage itself. It is the delay between the onset of symptoms and the moment a person picks up a phone and calls for help. If you are watching this video and you have ever dismissed chest tightness, arm pain, unexplained breathlessness, or sudden jaw ache because you thought you were too young, too healthy, or too unlikely, please hear this. A heart attack does not check your age. It does not respect your fitness level. It has happened to elite athletes in their 30s. It has happened to people who ate perfectly and exercised every day. The plaque that causes a heart attack begins forming in childhood, builds silently for decades, and announces itself without warning on an ordinary Tuesday morning. Now let's follow what happens when, in the best possible scenario, you or someone near you recognizes what is happening and gets you to a hospital in time. The doctors are working against that 90-minute clock. In the catheterization lab, a cardiologist threads a thin tube called a catheter through an artery in your wrist or groin, guiding it up through your vascular system until it reaches your coronary arteries. Using live X-ray imaging, they locate the blockage. Then they inflate a tiny balloon to compress the clot and the plaque against the artery wall, reopening the vessel. Most of the time, they deploy a small metal mesh tube called a stent, a scaffolding that holds the artery open permanently, preventing it from collapsing again. The moment that artery reopens and blood floods back into the starved tissue, something extraordinary happens. The cells that were on the edge of dying, the ones that had not yet crossed into irreversible death, suddenly have oxygen again. They begin to recover. The electrical signals in the heart start normalizing. In many patients, you can watch on the heart monitor as the chaotic, dangerous rhythms begin to settle back towards something resembling normal. But here is what nobody tells you about the aftermath. Heart attacks damage the heart by suddenly blocking the blood flow that brings oxygen to part of the heart muscle. Without oxygen from blood, heart muscle cells die and release troponin, a protein that leaks into the bloodstream. Troponin levels usually increase sharply within 3 to 12 hours after a heart attack and peak around 24 hours later. Doctors measure this protein in your blood to understand how much of your heart was damaged and for how long blood flow was interrupted. The higher the troponin, the more cells died. The more cells died, the more scar tissue will form. And scar tissue, unlike healthy heart muscle, cannot contract. It cannot pump. It is dead weight in an organ that needs every single cell to be working. Medline Plus, Cleveland Clinic. Your heart begins healing almost immediately after blood flow is restored, but that healing process is a scar, not a regeneration. The human heart cannot grow new heart muscle cells in meaningful quantities after a heart attack. What is lost is lost. The heart adapts around the damage. It compensates, it restructures, but it is never quite the same. How stuff works. This is why the 90-minute window matters so profoundly. Every minute within that window represents thousands of cells that might be saved. Every minute after it represents thousands of cells that are already gone. The good news is that today, your chances of surviving a heart attack and surviving it well, with a return of heart muscle function, are more significant than ever. Medical science has made extraordinary advances in the speed and precision of cardiac intervention. Hospitals track their door-to-balloon times, the number of minutes from when a heart attack patient walks in the door to the moment blood flow is restored, and work constantly to reduce them. Paramedics now transmit electrocardiograms from the ambulance directly to the hospital so that the catheterization lab can be ready before the patient even arrives. Clot-dissolving medications can be administered even before intervention begins. The system has been built, piece by piece, to fight against those 90 minutes. But the system only works if you call. The moment you feel unexplained, persistent pressure in your chest, not sharp, not stabbing, but heavy and squeezing, spreading to your left arm, your jaw, your back. The moment you feel suddenly breathless for no reason. The moment cold sweat drenches you without physical effort. The moment you feel an unexplained, overwhelming sense of doom, that instinct your body sends when it knows something is catastrophically wrong before your mind has caught up. That is the moment you do not wait. You do not drive yourself. You do not call a family member and ask what they think. You call emergency services. You sit down. You chew an aspirin if you have one and are not allergic, and you wait for help. Because inside your chest, second by second, cells are making the decision between life and death, and the only variable in that equation that you control is time. Here is the final thought I want to leave you with. The heart beats 100,000 times a day. In an average lifetime, that is more than 2.5 billion beats. Each one a small miracle of electrical coordination, muscular contraction, and fluid dynamics happening without a single conscious thought from you. Through stress and grief and joy and exhaustion and love and fear, your heart keeps going. It does not take a day off. It does not ask for gratitude. It just keeps beating. The least we can do is know what it looks like when it is asking for help. Share this video with someone who you love, not because you want to scare them, but because knowing this, truly understanding what is happening inside the body during a heart attack, could be the difference between a story that ends in tragedy and one that ends with someone sitting across from you at dinner, still alive, still laughing, because they knew what their body was telling them, and they acted in time. If you have not yet subscribed to this channel, please do it right now. Not as a favor to me, but because the kind of content we create here is designed to give you the knowledge that protects the people you love. We go deep. We go inside the human body. We take the most important medical events and biological processes in your life, and we explain them in a way that you can actually remember, actually use, actually share with the people who matter to you. Every video on this channel is built on the belief that understanding your own biology is one of the most powerful things a human being can do. Hit subscribe, hit the bell, and keep watching, because what we have coming next will change how you think about your own body forever.